Introduction to sleep apnea. Why this matters. Have you ever woken up feeling tired, even though you've had a full night's sleep? What is sleep apnea? Sleep apnea is a sleep disorder where your breathing stops temporarily during sleep. It can happen multiple times during the night, which can leave you feeling exhausted the next day. Interesting fact, did you know that nearly 1 billion people around the world might have sleep apnea and not even know it? If you found this information helpful, please give us a like and don't forget to subscribe to the channel for more health tips. Common symptoms of sleep apnea. Sleep apnea can be tricky to spot because the symptoms often show up while you're asleep. But there are a few common signs that might indicate you're dealing with this condition. One of the most noticeable symptoms is loud snoring. While not everyone who snores has sleep apnea, most people with sleep apnea do snore, and it's often loud enough to disturb a bed partner. Another sign is feeling tired in the morning, even after what seemed like a full night's sleep. That's because your body may have been waking up multiple times during the night without you even realizing it, just to start breathing again. You might also find yourself waking up suddenly during the night, gasping for air or feeling like you can't breathe. This is a clear signal that your airway was blocked, and your body had to jolt you awake to get enough oxygen. Some people with sleep apnea report having trouble staying asleep or waking up several times throughout the night without any clear reason. Over time, this interrupted sleep can lead to constant fatigue, trouble focusing, and even mood changes. So why do these symptoms happen? During sleep, the muscles in your throat relax. In some people, they relax too much, causing the airway to narrow or close. This blocks the flow of air, making it harder to breathe, or stopping it completely for short moments. If you recognize any of these symptoms in yourself or someone you love, it might be time to talk to a doctor. And if you're finding this information useful, don't forget to like this video and subscribe to our channel for more helpful health tips delivered in a simple, clear way. How sleep apnea is diagnosed. If you think you might have sleep apnea, the good news is, it can be diagnosed and treated. The first step is recognizing the signs and talking to your doctor. Your doctor will likely start by asking about your sleep habits and symptoms. They may ask questions like, do you snore loudly? Do you feel tired during the day? Has anyone noticed you stop breathing while you sleep? From there, you may be referred for a sleep study, also known as a polysomnography. This test is usually done at a sleep clinic or hospital. During the night, they'll monitor your brain waves, oxygen levels, heart rate, and breathing patterns while you sleep. It's completely safe and painless, you just sleep while the machines do the work. There's also an option called a home sleep test. This is a simpler version you can do in the comfort of your own bed. You'll wear a small device that tracks your breathing and oxygen levels overnight. While not as detailed as an in-lab study, it's a convenient way to screen for moderate to severe sleep apnea. Once the results are in, your doctor will be able to tell whether you have sleep apnea, how severe it is, and what the best treatment options are. Early diagnosis is important. Left untreated, sleep apnea can lead to serious health problems down the road, but with the right help, you can sleep better and feel better. How sleep apnea is treated. The good news is that sleep apnea is treatable. Once diagnosed, there are several ways to manage it and improve your quality of sleep and your overall health. One of the most common and effective treatments is a device called CPAP, which stands for Continuous Positive Airway Pressure. It's a small machine that gently pushes air into your airway through a mask you wear while sleeping. This keeps your throat open and helps prevent those breathing pauses during the night. It might take a little time to get used to, but many people find great relief with CPAP. In milder cases of sleep apnea, lifestyle changes can make a big difference. Losing weight, avoiding alcohol or sedatives before bedtime, and sleeping on your side instead of your back can all help keep your airway more open during the night. There are also oral appliances, which are custom-made devices that fit in your mouth like a mouthguard. They help move your jaw or tongue forward to keep the airway open. These are often used for people who can't tolerate CPAP. In more severe or complex cases, your doctor might discuss surgical options. These surgeries aim to remove or shrink excess tissue from the throat, reposition the jaw, or even implant a small device to stimulate the nerves that control breathing. Every case is different, so treatment plans should be tailored to each person's needs. What's most important is finding a solution that helps you breathe better and sleep more soundly, night after night. How sleep apnea affects heart health and blood pressure. Sleep apnea doesn't just make you feel tired, it can have serious effects on your heart and overall health if left untreated. When your breathing repeatedly stops and starts during sleep, your body is forced to react. Each time it happens, your oxygen levels drop, and your brain sends signals to wake you up just enough to start breathing again. This constant cycle of interrupted sleep puts a lot of stress on your heart. Over time, that stress can lead to or worsen high blood pressure, hypertension. Your body stays in a state of alert, even at night, which raises your blood pressure levels and makes it harder for your heart to rest and recover. People with untreated sleep apnea also have a higher risk of heart problems, including irregular heartbeats, arrhythmias, heart attacks, and even heart failure. That's because the repeated oxygen drops and sleep disturbances can damage the heart and blood vessels. Sleep apnea is also linked to a higher chance of stroke and type 2 diabetes, which can further impact heart health. In short, poor sleep doesn't just make you groggy, it affects how your entire cardiovascular system functions. But here's the hopeful part: treating sleep apnea can significantly lower these risks. When you start breathing better at night, your heart doesn't have to work as hard. Many people see improvements in blood pressure and feel more energetic and focused during the day. So if you or someone you love is living with sleep apnea, know that taking action now can help protect your heart for the long run. Final thoughts and advice. Sleep apnea may sound scary, but the truth is, it's manageable. The most important step is awareness. If you've noticed symptoms like loud snoring, constant fatigue, or waking up gasping for air, don't ignore them. These could be signs that your body is struggling to get the rest it needs. Talk to your doctor, ask questions, and don't be afraid to explore testing options. Whether it's a home sleep test or a full study in a clinic, knowing what's going on with your sleep can change your life. Remember, untreated sleep apnea doesn't just make you tired, it can raise your blood pressure, put extra strain on your heart, and increase your risk of serious health problems down the line. But with the right support, treatment, and lifestyle changes, better sleep and better health are within reach. Thank you for spending time with us today. If you found this video helpful, please give it a like, leave a comment below to share your thoughts or experiences, and don't forget to subscribe to our channel for more easy-to-understand health tips. Your support helps us keep making content that truly matters. Sleep well and take care.